Okay, great. We will go ahead and open up a public hearing on Senate Bill 727, and I will ask Whitney for an explanation, please, and I will ask Senator Gelser Blouin to come forward.
Thank you, Chair Taylor, Vice Chair Blouin, and members of the committee. Senate Bill 727 is brought to you by Senator Gelser Blouin. There are currently no amendments. There is no subsequent referral. What the measure does briefly is modifies the definition of healthcare provider regarding a chiropractic physician for purposes of the Oregon Family Leave Act, and the measure takes effect on the 91st day following adjournment sine die, and I can't remember if I said it, there are no subsequent referrals.
Because there hasn't been a work session scheduled, or because there has already been determined there's no fiscal?
We don't have the paperwork yet, so it hasn't been officially
I have no idea. I
determined,
was
but
just asking.
presently, there are no prior
Okay.
subsequent referrals.
Welcome.
Thank you, Chair Taylor. Members of the committee, for the record, my name is Sara Gelser Blouin, State Senator from Senate District 8. I'm here today with my constituent, Dr. Vern Saboe, who we were having a conversation last fall, and he was explaining to me this outdated piece of statute and mentioned how nice it would be if we could fix that. So this is the problem. There's a long list of folks that can sign off on leave, and chiropractors are under that, but it requires that the person use an outdated procedure that is also quite expensive and unneeded. And so this bill does exactly one thing. It would remove the words after chiropractic physician, but only to the extent the chiropractic physician provides treatment consisting of manual manipulation of the spine to correct a subluxation demonstrated to exist by x-rays. The x-ray is not necessary to provide that treatment. It's not the standard of care, and it's costing people more than they need to get their care. And so that is what the bill does.
So to just make sure I understand, so you're saying that right now, in order for a chiropractor to sign off on paid leave, they would have to do an x-ray.
Correct.
And you want to make it so they don't have to do an x-ray.
Chair Taylor, members of the committee, that is correct. None of the other practitioners are required to do any type of procedure. Everyone else is just, a dentist is not required to do an x-ray for the dental care. A psychologist isn't. I don't know what an equivalent of an x-ray would be for a psychologist, but
Brain scan.
The naturopath does not have additional things to add. So I think if you often think about just in terms of different medical types, naturopaths and chiropractors, but it's only registered nurses, only chiropractors have this limitation.
All right. Okay, Mr. Saboe.
For the record, Dr. Vern Saboe, representing the Oregon Chiropractic Association, and I so appreciate the senator bringing this forward. This is antiquated, non-evidence-based language that's decades old, and the other issue of this is beyond expenses, public safety. It's exposing patients unnecessarily to ionizing radiation, which there's been shown a connection with. Cancer and other degenerative changes that can occur over time. In addition to that, it really suggests an antiquated supposition of why what we do works, and that is the notion of realigning small misalignments of the vertebra, which has been discarded for a joint dysfunction or lack of normal motion, or what the medical literature refers to as joint play. So it's more, in lay terms, we're unstucking stuck joints, not repositioning small misalignments or subluxations. So to require an x-ray to find an entity that has no clinical consequence is ill-advised. It's not in the best interest of injured patients or patients in general, and it's not something that any of the state, national, international imaging guidelines, evidence-based guidelines recommend. In fact, they recommend against routine x-rays, and this would fall into that category.
Okay. I just have a question. So if you were, if the patient, regardless of paid leave, needed to get reimbursed insurance-wise, would an x-ray be needed?
To get reimbursed? No. not at all.
To pay for so that an X-ray is never needed under those circumstances?
No.
And then what about workers' comp claims? Are
No.
X-rays required?
No, it's only when they're clinically indicated. It's the history, what happened to the patient, presenting symptoms, your examination findings. That's what determines any kind of imaging, whether it's a plain film X-ray, digital X-ray, or special imaging, MR, CT, PET scans.
So this particular language, excuse me, is this within paid leave, or I don't understand where this language lives?
Thank you, Chair Taylor. It's modifying the definition within unpaid protected leave provision.
Oh, on the
within
unpaid. I see. It's
I would
under
have
the
to double check
unpaid.
whether paid leave Oregon also uses.
Are you sure that
there's
the paid
cross-references,
leave Oregon uses that language too? Are you positive?
Not that I'm aware of.
So you're talking about the unpaid leave?
This is the Oregon Family Leave Act that this is under. The other, what did you call the other? That's a different, newer.
So it's totally fine. So we have, in 2019, we passed what's called Paid Leave Oregon, but we've
Right.
had for a long time what's called the Oregon Family Leave Act.
Right. That's a different animal.
It's okay, we can get to the bottom of it, but I just was curious.
Yeah.
I may have information that is helpful.
Yes.
Madam Chair, Vice Chair Bonham, Lifeline, an October 17th, 2024 memo from the Legislative Council says enclosed is LC 642, which amends the definition of healthcare provider under ORS 659A.150 to remove outdated language with respect to chiropractic physicians. Please note that this change not only affects leave under ORS 659A.150 to 659A.186, which is commonly known as the Oregon Family Leave Act, but also applies to ORS 653.626, which governs the medical verification requirements for purposes of sick leave. Specifically, for purposes of ORS 653.626, healthcare provider cross-references the definition of that term in ORS 659A.150.
What does that mean?
It just means that the definition shows up in both of those places. And so even though I requested the measure to address this issue, the council was pointing out that this definition is pointed back to both by OFLA and for the sick leave purposes.
You just said it. That's what I
Okay.
wanted to clarify. OFLA and sick leave.
Okay. Well, this is our first public hearing, and so your request is for a deletion? Is that what the request
Correct.
is?
Correct.
For a
It's-
deletion?
Yeah, it's on page, the only change in the bill is on page 2, lines 12 to 14. It's just the deletion. There's nothing else. It's just the end of the sentence that describes the X-ray. There is no other change it's the only change in the measure.
The specific line is, but only to the extent the chiropractic physician provides treatment consisting of manual manipulation of the spine to correct a subluxation demonstrated to exist by X-rays.
Okay, yes. Any
Thank you, Chair
questions?
Taylor. Yeah, so just to clarify, you're still providing the service, you just don't have to prove through means of an X-ray that there was a condition that you're treating.
Correct. And it's really an entity that has no clinical significance. So you'd be exposing a patient to ionizing radiation for a very silly reason.
Okay. Well, we have other people who have signed up to testify, so, okay, all right, thank you. All right, and Paloma Sparks? Good evening, thank you for being here.
Good evening. Good evening, Chair Taylor, members of the committee. For the record, Paloma Sparks with Oregon Business and Industry. As you are all too painfully aware, we get to talk about paid leave and Oregon Family Leave Act all the time. We have, OBI has been part of a lot of discussions. I personally have been around a lot of discussions around the Oregon Family Leave Act. As you know, a couple years ago, we changed the Oregon Family Leave Act so it does not cover the same sorts of medical conditions as it used to, because those are now covered under Paid Leave Oregon. We have some serious concerns about the idea of expanding without some limits related to chiropractic physicians. We would like at least, maybe an x-ray isn't required, but there needs to be some identification that there is, in fact, a serious health condition at issue, and something that fits our statutory definition of a serious health condition. Lots of people go to see a chiropractor for things that wouldn't meet that definition. And there's been a lot of back and forth, a lot of discussions about what kind of providers are covered, the circumstances under which they're covered. So we have some fairly serious concerns about this bill and changing it and expanding it. Additionally, I think we know that there are some issues around some definitions related to paid leave organ. I don't think that this bill would carry over, and so probably wouldn't make sense because under OFLA, a serious health condition leave is no longer covered, except to the extent it covers for pregnancy disability. And then it covers bereavement leave and sick child leave. So the definition here probably wouldn't make that much sense.
So are you saying that they're proposing, the language that you're seeing is proposing making changes to OFLA, and you're noting that in the last short session, we changed OFLA to the point where there's only 3 remaining components and does not cross-reference with this anymore? Is that what you're saying?
Chair Taylor, correct.
Okay. So there may just be a language thing, so go ahead. Okay. Any questions? Okay. But having this clarity in paid leave, you would be okay with or not? If this language had nothing to do with OFLA and only had to do with paid leave, would you be okay with that?
Chair Taylor, we would have significant concerns about the proposed language that we've seen in the bill as presented. I think we understand that there may not be a need for an actual x-ray, but there needs to be some more sideboards than simply just saying a chiropractic physician can be a healthcare provider, because we also need to make sure that we're talking about serious health conditions, not general maintenance treatment.
Okay. Yes.
Thank you. So are you suggesting that there should be some sort of code, CPT code or diagnostic code here with the chiropractic physician to basically line that up with what the condition is, or what alternative are you suggesting, if any?
Chair Taylor, Senator Hayden, I think it needs to be specific to the type of serious health conditions that chiropractors regularly treat. If you were to move forward with this bill, our preference would be that you not move forward with the bill.
Well, this is our first public hearing. Yes, Vice Chair Bonham?
No, but it does beg the question in my head. Literally, so I've sought chiropractic care in my life, and I have benefited from it, and I have never been required to have an X-ray to submit my claim to my insurance. Like I'm trying to walk through this. Like, this
that's why I asked the question. Like,
yeah,
what-
this is causing me some fits. Like, what? What is it? Does a dentist have to provide an X-ray for cleaning? Like if we're going to walk down this path, like then are we going to start evaluating every single medical provider's threshold, or do we already do that? Am I unaware that we have thresholds for when you, like, none of these other things, like, well, and I know this is OFLA because I'm looking at this bill, which is referencing OFLA statute, but like a dentist license under ORS, but there's nothing after that that says the dentist has to provide an X-ray or the dentist has to show proof of cavity. Psychologist license under, but the psychologist doesn't have to, document why the treatment was necessary. So, like, it does seem interesting that the chiropractic language is the only one that had this kind of secondary language. I don't know if I have a question other than just a statement that I do find it odd that one is called out, and a registered nurse doesn't, a naturopath doesn't, an optometrist doesn't, a psychologist doesn't. Like, we can go down the whole a regulated social worker does not.
Well, I think what would be helpful, at least in my opinion, is if we had paid leave, the agency here, this is just the first public hearing.
And
So-
it's, right, because in this case, we're talking about two, sick leave and OFLA. And I am curious to that point about the paid leave, but
Well, the registered nurse is a specializing nurse in midwifery, just for clarification.
okay.
But the intent is for this to apply to paid leave because it's no longer relevant for OFLA. There's just not something, there's something, I believe, incorrect in the drafting. Because you're trying to talk about paid leave, you're not, because OFLA, this doesn't exist under OFLA anymore. So regarding sick leave, that's not, I have no idea if they're talking about sick leave too, because I don't think there's anything required under sick leave at all about any kind of, for the 5-day sick leave under Oregon. Again, I'm getting ahead of my skis. We
right.
need to have someone research that. You don't need to have any medical. You can just take your 5 days of sick leave.
Line 5.
What?
He corrected me on my registered nurse comment, but that's line 8. Line 5 just says registered nurse.
You're correct. I didn't pre-read it, sorry, I
Okay,
apologize.
everybody. All right, everybody. Okay, again, first hearing, we can consult with Paid Leave Oregon and find out exactly how is this actually working, what's actually really happening. I'll be curious to see if there's something different in rulemaking. There is a lot that has happened in rulemaking, so I'll be curious. You probably already know the answer, Paloma. But let's just, again, first hearing, we can, anything else you wanted to add, Paloma? Okay, all right. So Senator Gelser, Blouin, I think that there just needs to be a few extra questions answered, but I am sure you're on top of it. You're probably taking notes. You're in good hands. Don't worry. She's a veteran. She's been here a long time. She knows what she's doing. All right, we'll go ahead and close the public hearing on Senate Bill 727.